Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq. Healthify founder and CEO Manik Bhat joins me to discuss the need to invest in community services to address racial and social health inequalities. Manik, it's great to have you with us. Welcome to Trade Talks, and explain to us how racial disparities have such an impact on health.
Well, first, thank you, Jill, for inviting me. Humbled to be here. You know, this is a pretty critical topic in a pretty critical time, right? We're living in an environment with a massive epidemic that is primarily affecting Black and Brown communities. And it's following a lot of the racial inequality lines we've seen historically for many, many years. You know, by way of background, I got my start doing community health work in East Baltimore for a number of years in a pediatric setting, and saw day in and day out how social needs impact an individual's health, and also saw how the impact was exacerbated purely based on racial lines. And just to give a sense of the phrase we always use, which is zip code matters much more than genetic code. The zip code I worked in East Baltimore, if you went two zip codes to the right, the difference in life expectancy was 20 years, right? Massive difference in life expectancy. And just to talk a bit about some of the key metrics here, Black and Brown communities experience hospitalization or death from COVID-19 at rates 4 to 5 times greater than Caucasians, right? And that's due to everything from access to healthcare services to how these communities are being seen in terms of COVID-19. African Americans are 77% more likely to be diagnosed with diabetes. The mortality rate for breast cancer and really all cancers across African American women is 40% higher than most other ethnicities. And as I mentioned, the average U.S. life expectancy is about 15 to 20 years shorter in low-income communities than those in affluent communities. So we're dealing with a time where these disparities existed and are now exacerbated when you layer it on top of COVID-19, where the economic impact of COVID-19 is hitting previously communities that were previously non-affluent or current communities that are low income. So we're seeing kind of two trend lines go in the opposing directions that we don't want to see.
And that leads me to the next question. How has COVID-19 impacted social services and health programs? Because of course, the concern was, especially when this first started, a lot of children depend on schools for their daily food intake. And a lot of people were afraid to go to the doctor because of contracting COVID-19. And I can only imagine that it exacerbated it further.
Yeah, absolutely. And you're going back to how these things fall under racial lines is, when we look at even how hospital PPE was distributed, we can see some interesting trends there that manifested in the results we're seeing today in a lot of communities. Now, the main two things when we think about COVID-19 and its impact on social services is understanding supply and demand. And when we look at the demand of social services as quarantine began, we saw a massive increase in food and childcare needs, right? And a massive increase in unemployment claims right at the beginning of quarantining as a lot of non-essential businesses closed. And just to give you a sense, we're a company that serves families in all 50 states. And generally, on any given month, a lot of the services we are providing to families and getting referred to, about 16 to 20% of those services are related to food. So food bank, food pantry, access to healthy food or nutritious food. As quarantining began, that percentage and number skyrocketed to 36% and upwards of 40% in certain communities. So massive increase in food demand. Concurrently, at the same time, the capacity was decreasing, right? You got a lot of these community-based organizations shut down because they were losing funding, did not have volunteer capacity. So again, these two opposing trend lines. You had increase in demand for these services and a decrease in supply. And then as quarantine ended, we saw some decrease in childcare demand, but increased shelter demand as a lot of evictions rose, and then the food demand remained elevated. And now we're continuing to see increased shelter demands because a lot of the public benefits regulations that were enacted in response to COVID have now been reenacted. So some people are losing access, and a lot of these new delivery models for services that are emerging to really meet the demand crisis in social services. So in a nutshell, not to sound too doom and gloom, COVID-19 has exacerbated the social needs and social service capacity gaps in majority of communities. And it's really a rallying cry, we think, of it to say, how are we going to build infrastructure for long-term recovery? How do we move to a journey and move to an environment where communities have services, have social services to meet the demand, especially in an environment where a lot of communities are going to be suffering now and suffering down the road because of long-term impacts of the epidemic?
Right, of course, and without a coordinated national response, potentially helping to eradicate COVID-19, it gets exasperated, which seems to be the key word in this conversation. So why is it
Right.
critical to invest in community services to address these issues? Will investment get us to an end goal?
Yeah, yeah, it does. And, this is a big core of the mission of Healthify, right? We know that 60% of someone's health is driven by social needs: food, housing, childcare. We know that majority of cost in the healthcare system, when we talk about we spend a lot on healthcare, when we look at the numbers, a lot of that spending is misallocated. We're not spending on the things that matter. We're spending far more on reactive care versus proactive care. So we think of a world where, social service organizations are really healthcare. They're really supporting families with the core needs that they need to be healthy and thrive in the communities that they live in. And without that infrastructure and without that capital, then we have worse outcomes at a higher cost. So we view the conversation around investing in social services to have kind of wide bipartisan appeal. It's not only the morally just thing to do, it's the financially responsible thing to do. And it's high time we make these investments, because the time is now, due to COVID-19 shining a bright light on how bad some of the infrastructure is in a lot of the communities we serve.
Right, and it makes complete sense. I mean, the more preventative care you offer, it'll be less expensive to treat it once it's something that could have been stage 1 is now a stage 4, and it's simply because somebody didn't have access to healthcare. It's not
Right.
fair. It's not a fighting chance. So, tell us a little bit more about Healthify. Where are you in this ecosystem, and what solutions are you delivering?
Yeah, no. So we operate firmly in this space of how do we help families get access to social services, right? We primarily work with large health insurance companies, health systems, public sector entities, and community-based organizations. And at a high level, we do 4 big things. Number 1, we help with analytics in this space. So when you're trying to manage a population of 1 million people, it's really hard to know who in that population is food insecure, who in that population has social isolation issues or behavioral health issues, or is at risk for homelessness, or needs childcare or financial assistance. So we built these predictive models to help identify cohorts of individuals and individuals in need and stratify their risk to say, hey, we know that this person is high risk for food insecurity. And we know that if we address that food insecurity with a food program, there'd be this ROI on that intervention. So we start with analytics. Then the majority of our work is we deploy a platform to help folks coordinate these services in the community. So if you are a healthcare staff member at a clinical provider, a health system, or a health plan, or you're Meals on Wheels, and you're trying to coordinate care amongst a community for myself, you can do that in our platform. We help you find these community services. We help you coordinate these referrals across all of these different players and really track the success when a referral is made to a social service entity. So now, let's say you were working with me and identified, hey, Manik, you're a diabetic senior who needs Meals on Wheels. With Healthify, you can find that Meals on Wheels, send them electronic referral. Meals on Wheels is on the other end, receives that referral, and can let you know if I showed up. So really coordinating the service delivery of social services in healthcare. And we do that by actually providing that network. So that Meals on Wheels in that example, we work with them and contract with them and bring that network into the healthcare ecosystem for folks to coordinate. And a way to think about this is your clinical provider network. Everyone has their network they can get access to. We're taking that same concept and applying it to social services. What is a network of social services that can really support a community, can really support a family across all these needs in a systematic way? And then finally, what's really critical for us is, what is the ROI? What is the sustainability for this space? Because, while this is ultimately net positive for communities, we know that long-term, the ROI needs to be there. So a big component of our work is proving that ROI across these interventions. And, one example we like to share is some of the work we've done in Pennsylvania, where we worked with a health system in a pretty rural area with a lot of different community partners and allowed them to see a 15% reduction in ED cost and ED utilization in 1 year, which is a pretty substantial change just by connecting those families to social services in a more robust, safer, and equitable way.
All right, Manik, thanks for all the insight, and thanks for joining us on Trade Talks.
Of course. Thank you so much. Take care.
You got it. And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.